Hello, everyone. A beautiful day today. I am John from OSP. So welcome to our 7th webinar on digital health technology. In our last webinar with Vincent Cunan, we spoke about personal health record, PHR, and their significance. Today, we're happy to have Stacy Hurt, a HIMSS 20 digital influencer and patient consultant, to talk about the need to engage patients in the decision-making process of their own treatment. Patient engagement is crucial for successful response to treatment. And while innovation in digital health keep coming to meet the growing needs in healthcare, patients are often excluded from important decisions regarding their health. Can digital health technology resolve this issue? Let's hear about Stacy's take on this topic, her thoughts on the need for considering patient opinion, and how health technology can help patients add their thoughts on care matters. So welcome to the webinar, Stacy, and thank you for joining us today.
Hi, John. Thank you for having me today. Thank you for your attention to this important topic. Thank you to OSP Labs and everybody who's joined us. I'm excited that today is the last day of Colorectal Cancer Awareness Month. I have my blue on. I just want to remind everybody to get screened. It's also the last day of Developmental Disabilities Month and the last day of Women History Month. So it's been quite a busy month of March.
Thank you, Stacy. So we're going to start the webinar with a few questions for Stacy, and then the last 15 minutes, we're going to open for Q&A session for all attendees. So Stacy, it's been a while, but congratulations again on being selected as a HIMSS digital influencer and healthcare change maker. So can you tell us about your experiences as a change maker?
Sure. Well, it's been an amazing opportunity. I still remember applying to the program. I was out on Twitter and I saw the invitation. I knew about HIMSS because I had worked, prior to becoming a patient and a caregiver, I had worked in physician practice management, pharmaceuticals, a lot of different healthcare functions in healthcare technology. So I knew all about HIMSS. And when I saw on Twitter that they were having this digital influencer program, I said to my husband, I said, you know, they need somebody like me. They need somebody who has worked in healthcare, but also been the recipient of healthcare as a patient and a caregiver. And they were only choosing 10. And I said, you know, I'm just going to apply. I don't think I'm going to get accepted, but I'm just going to apply. And I still remember the day sitting on my chair when I received my acceptance notice that I was in the program. And then I got to connect with a few of the other influencers, and my son was reading the list and he said, well, this guy has 10,000 Twitter followers and this woman has 30,000 Twitter followers. And I think at the time I had 1,000. But I was so honored to be there amongst this group representing the patient voice and the caregiver voice. And this group of individuals has been so incredibly receptive and supportive to our exchange of opinions in, you know, design thinking for patients, for, you know, being on this side of it as well as tech professionals. So it's been amazing. It hasn't been what we thought it was going to be, obviously, because of COVID, but it has presented amazing opportunities and a chance to be on a webinar like I am today. So it's been incredible.
Thank you, Stacy. Now, every change maker has a story to tell. Can you share something that inspired you to make a difference?
It would definitely be my experience as a caregiver for our intellectually and developmentally disabled son, Emmett, and my experience as a stage 4 colorectal cancer survivor. I remember when Emmett was diagnosed and we were going through the process and we stopped counting at 60 different specialists that we were going to see to have him examined head to toe for his very rare chromosome disorder. And, you know, the back and forth to the hospital and the grind of it all. And it got to the point where I called the doctors and I said, can't we do this via computer? So he's 15, so this is 15 years in the making. And I said, can't we do any of these via the computer? And they all said to me, no, you have to come in. And to this day, I can't even tell you how difficult it is. He has to be lifted. So I have to lift him off the floor onto the chair to put his shoes on, into his wheelchair, into our accessible van, transport him to the doctor's appointment, wait while he's immunosuppressed and I'm immunosuppressed. And I just said, there has to be a better way. And so now with COVID, we've seen the acceleration of telehealth, and all of a sudden, years of innovation have compressed into a few months. And you better believe that I'm going to advocate and fight hard for telehealth to stay. And I'm so honored to be part of the Telemed Now Thought Advisory Council, who are advocating for telehealth to remain post-pandemic, post-public health emergency, because I've been asking for this for 15 years. So I'm certainly not going to let it go now. And it has been a huge help, to me as Emmett's mom and caregiver. So, and then the times that I was sick in bed from chemo, and all the times that I couldn't move and I was nauseous and fatigued, and I had appointments with my oncologist, and I was like, why can't I just check in from my bed? It would be really great if I could just open up my laptop and talk to my doctor and tell him how I'm doing, and it wasn't available. So telehealth is a tremendous breakthrough for patients and caregivers.
Thank you. Yeah, several comments already came related to technology and telehealth. We're going to cover that in more depth in a few moments. Now, the healthcare industry is going through many transformations, and yet it faces new challenges. One of the most common is patient-centric care, and advocacy is part of the work you do. So can you briefly share your journey and what typical challenges you see patients struggle with?
So, I have been very fortunate and blessed to come out on the other side of stage 4 colorectal cancer. I had an 8% chance of doing that, and I just hit 5 years cancer-free. So it's been an amazing journey. So the whole time, since I worked in healthcare, I sort of emerged as this sort of patient advocacy expert, because I knew how to talk to medical professionals as a patient. So as patients were fighting appeals or fighting for scans, et cetera, I became regarded as somebody who knew how to talk the talk. And that has just only grown. So the biggest the biggest issue that I get on emails from patients around the world are a couple things. Number one is getting second opinions. So a patient will come through treatment and they're deemed non-surgical, and they want to know if they're surgical. So these are patients that perhaps are based in very rural, underserved areas that are miles and miles away from a National Cancer Institute, NCI Cancer Center that really have the gold standard of care. And either because of transportation burden or because of disease severity, because they're so sick, they are unable to travel, or financial barriers. They're unable to travel to an NCI Cancer Center for a better evaluation of their case. And they write to me and they say, Stacy, can you get me a second opinion? And for a while there, I was literally, patients were sending me their discs and their medical records by mail, and I was bootlegging them down. I'm based in Pittsburgh, down to UPMC, University of Pittsburgh Medical Center, where I was based, trying to get them a second opinion. I was doing this all grassroots. And again, I thought there has to be a better way. There has to be a better way to maintain privacy for these patients and transmit their records digitally to get them a second opinion. So that's number one that I hear about. Number two is this problem that we have with interoperability, that your medical care is spread across 3 different institutions and they're not talking to each other. So this happens to me all the time. I get my scan at one place, I had my surgery at another place, I had auxiliary care at another place, and all 3 of them are on different electronic medical records. And they're literally sending discs through the mail and faxing medical records to talk to each other. No, it's 2021. There has to be a better way to do this digitally. And this just happened to a friend of mine. He has glioblastoma. He's being seen between Dana-Farber in Boston and University of Pennsylvania. And it took 2 weeks to get his scans to each other to talk about his next plan of treatment. This man doesn't even have a day to spare, I'm just going to tell you. And it took 2 weeks. It's unacceptable. It's unacceptable.
Yeah, certainly this is a great point, Stacy. And in fact, we often ask, as a technology company, to help with the interoperability and communication, and of course, HIPAA compliance as well. So that's another topic. We'll touch on it today, and we have other webinars where we discuss these in more details. Now, to focus on your really focus, from your experience, how valuable is patient opinion?
Well, patient opinion is critical in design thinking. You cannot absolutely design something for patients without having patients involved in the development. It makes zero sense to me. And I'll give you an example. So I was diagnosed in 2014, and my oncologist now has known me for 7 years. My oncologist knows me better than some members of my own family. He knows my background in healthcare management. He knows about Emmett, and he knows about the work that I'm doing now as a patient consultant in patient involvement and patient engagement. So he knows everything that I'm doing. And he was just asked to design a new infusion center that's part of the community hospital where I'm treated. And I didn't know that he was doing this. And then I saw the hospital communication, and I just want to read you a few of the quotes that it said that members of the hospital leadership team visited model cancer centers across the country, and their goal was to create an environment that was patient-focused. Viewing the experience through the eyes of the patient was the touchstone for all design and planning of the treatment center. And then there was a quote from my oncologist. He said, "We asked ourselves a lot of questions in order to understand the patient's experience. What does the patient feel? Are there access issues? Does this meet their needs?" And the leadership team and physicians prioritized patient-friendly design. And the result is a powerful expression of the hospital's commitment to enhancing the patient experience. So if you were playing a drinking game and you were drinking every time the word patient was mentioned, you would be a little tipsy right now. But what's most shocking about what I just read you was that my oncologist didn't ask for my opinion at all. And he did not enlist the help of any patient focus groups at all. And of course, you're getting to know me, I'm very outspoken. So I asked my oncologist very kindly, I said, "I'm really disappointed that you didn't include me as part of your patient focus groups." And his response was, "What patient focus groups?" So if my oncologist, who knows me this well and knows my work, didn't ask my opinion in being involved in the design of a new treatment center, that just shows you that we have a long way to go in enlisting patient opinion. And as disappointed as I was in his response, it's on me. I have not yet proven my value to the hospital. And so I need to work harder to prove my value as a patient and in lending my personal experience to this matter. My thought is you cannot have a patient experience department without patients being part of the leadership team.
That is so true. And I am seeing more movement, of course, in that direction. And hopefully it's going to get better. We're going to ask you more of your opinion on that later. In the meantime, though, let's talk a little bit about patient education. While the health sector is coming up with many innovations, there seems to still be a failure to bridge the gap of patient education. What are your thoughts on this, and how to take care of that challenge?
Yeah, no, John, health literacy is a huge gap. And I don't know if you follow, Startup Health puts out a report at the end of each year, and it shows the investment by venture capital firms in different healthcare functions. So if you looked at it from 2019 and you looked at it from 2020, the biggest investment by far is in patient empowerment tools. And that's great, that's awesome. But if you look at both years, the least investment is in education and content. And as a matter of fact, in 2020, it was education and content was a quarter of the next higher spend, which was insurance. So how can you be developing patient empowerment tools as your largest investment, but your least investment is education and content in how to use them? I don't understand that at all. So in other words, you have some of these health tech companies designing all of these shiny, new, fun devices and gadgets and toys, but nobody knows how to use them. So I think we need to flip the script a little bit and almost say that we need a 2-to-1 ratio in education to the tools that we produce. In other words, there should be twice the amount of information on how to use something than actually, putting it out and developing it. I just think patients don't know what we don't know. And I'm sitting here speaking to you as somebody who, I have 2 master's degrees. I have an MBA and I have a master's in health administration. And I think about when our son was diagnosed, there was no playbook. We had no idea what to do. When I was diagnosed with cancer, nobody said, this is how you beat cancer. I had to figure it out. And I'm very blessed and fortunate with knowledge and financial resources. What does everybody else do? What do our underserved populations do? What do the elderly do? What do the vision impaired, the hearing impaired, the language impaired do? We have to reach these people. We have to help them. Yeah, it's a real problem.
Yes. Well, thanks, Stacy. And somewhat a related question is, have you seen progress in how healthcare technology is addressing social determinants of health?
Yeah, another great question. We talk about, especially in the advocacy community, meeting patients where they are. And that means a lot of different things. It means where they live, work, and play, sure, but it means, where they are in their journey. So I look at social determinants of health as sort of a macro and a micro problem. And by that, I mean that, first of all, we know that social determinants of health account for 40% of health outcomes. So your situation determines how well you're going to do against a certain disease. So I think on the macro level, we need to enlist sort of artificial intelligence, machine learning to analyze disease trends, behaviors, and see kind of what's going on at that level so that we can focus our resources in and get people the tools that they need to succeed. Everyone deserves the best healthcare. Everyone deserves an equitable shot at beating cancer, at raising a disabled child. So it's figuring out, how we're going to serve them. And this is a double-edged sword for me, of course, because again, we can create all of these new innovations in digital health technology, but if they're not accessible and affordable, what good are they? And the other question to that is, who's going to take ownership of that? Is it a health system that requires you to access a patient portal for your test results? Well, what if because of the social determinants of health, I don't have universal broadband access and I have to go to a coffee shop or a library to access my test results? Then you have privacy concerns. So somebody really needs to own this issue. And universal broadband access is a fundamental need that drives everything else. Like I said, patient portals, telehealth, et cetera. And somebody really needs to own it and provide it.
Thank you. You're bringing up a lot of wonderful points. And I've noticed many of the attendees are sharing information with each other, and we're really encouraged by that. So there is a lot of thinking and a lot of ideas, and I'm looking forward, to sharing some of those later and encourage more discussions and more progress. Now, another question for you. Have you seen some health technology encourage patient participation? And do you know, certainly they're trying, but have you seen progress? And do you know any specific apps that can help?
Yeah, no, I love remote patient monitoring. I think it's amazing for empowering patients, especially in COVID. Here we were sheltering in place at home. And so remote patient monitoring was a great step in trying to, maintain health status for the pandemic situation. So in terms of specific apps, I mean, I'm sort of a tech, don't tell him that I'm sort of a tech dinosaur. It's, let's keep that between us. But, I love the Calm app. I think in terms of mental health, telehealth has been the biggest boon for, we saw, John, we saw a crash in mental health, but we saw this huge uptick in telehealth, and it really helped bridge the gap. And it's great for privacy, and telehealth for mental health is amazing. So I like the Calm app for meditation. I think my friends at Carium are doing excellent things in terms of mind, body, wellness, in terms of treating the whole person. I love what they're doing. My friend Jamie Edwards at Cloudbreak Health doing amazing things in terms of overcoming language barriers at bedside and interpreting. So there's some people, doing some great things out there. But I always kind of like to give the flip side of things. So, these things are great. Wearables, RPM, amazing. But they're capturing a ton of patient data. And do patients know that that's happening? Again, your average patient does not know all the amount of data that's being captured on him, her, or them. And again, if you are a tech company, you're listening to this webinar right now, I implore you to be transparent about your purposes for capturing and mining data with your patients that you're taking it from. We need to know what you're using our data for. And certainly if you're selling it, we need to know, and we need to provide consent. So again, front facing, these things are awesome for maintaining care. On the back end, let's be transparent about the purposes we're using them for.
That's very interesting. And in fact, I have seen a movement where more organizations are asking for permission to share to use the information for research or for other purposes. So I think permission-based is probably a good idea, and there probably will be a movement in that direction, maybe even some policies in that direction. Now, we keep talking about telehealth and how it's really helped. And do you feel it's really going to help also patients voice their thoughts? And have you seen a movement in that direction where it's now just one way, but it's actually a two-way communication, encouraging that from patient to share some of their challenges?
Yeah, no, John, I love the way that you phrase that question, because to me, telehealth doesn't just stop at a visit. People think of telehealth as sort of a point of care, one hit wonder visit. And telehealth, to be where we need it to be, it needs to be a whole integrated relationship. It needs to be a two-way street. It needs to be shared decision-making, a patient full participation with their clinical team. And so it shouldn't be, like I said, this one-hit wonder. It should be an ongoing monitoring relationship. And that's where we need to pull in. That's what's going to be the next big thing, is integrating RPM and telehealth and have a consistent, a continuum of care, if you would, along a patient's journey as to how they're doing, and improve those outcomes. So take, for instance, a patient who's a diabetic, and it's checking in via telehealth as to how they're doing, but it's glucose monitoring of taking their different blood sugar levels, and then feeding that back into, okay, well, what are your behaviors? What are your eating habits like? Are you getting enough activity, exercise? And so those are all components of telehealth that need to come together to take it to the next level. So once we solidify it as a permanent option, and again, let me clarify, telehealth does not replace face-to-face visits. Some people think, oh, telehealth's taking over and we're going to be doing everything via telehealth. No. As a patient, I can tell you that options are good things, and that the more options and choices that you have, the better, especially somebody like me that is really confined by a set of circumstances here that are out of my control. So, so we need to think about telehealth in terms of improving accessibility and providing options of care, and full patient participation, as you said, is a relationship with the clinical care team and all those members, the social worker, the nurses, the dietitian, the financial counselors, et cetera. Yeah.
Yes, thank you. And again, there is a lot of exchange right now. Now, another thought is physicians, of course, have deep expertise in their field and also meet a lot of patients. At the same time, patients sometimes have certain opinions, or they also have maybe adjacent conditions. And how do you feel that physicians can show empathy to patients in a constructive way, and so that it's really more of a positive outcome, both for the patient and for the physicians?
Yeah.
Or
no,
the healthcare staff. Yeah.
Yeah, no, great question. I love empathy. I have believed in empathy. I was the original empathy believer way back, because I think just by virtue of caring for Emmett, what happened with Emmett and then what happened with me. So I think that we all need to go an extra mile and put ourselves in the shoes of the person that this is happening to. And unfortunately, or fortunately, COVID educated us a lot on empathy. COVID showed us that you can be healthy as a horse today and be struck down as a patient tomorrow. And that was a world that I, unfortunately, was very familiar with. You know, I mean, I was the healthiest person I knew before I got cancer. I never saw my situation with Emmett coming. I had no idea. So that level of vulnerability has been my norm for 15 years. I am very fortunate that I have had medical teams that have been incredibly empathetic to my situation and have taken into account all my different factors. Like my oncologist, for example, you know, he knows what's going on with Emmett, and he always designed my treatment around my life. He treated me as a person, not a patient. And so bringing in those elements into digital technology is going to be challenging. You know, I mean, look at us, we're on a screen. I mean, I would love to be sitting across from you right now, having coffee and hugging you and, you know, put my hand on your shoulder and everything, you know, but we have these screens. So we really have to go that extra mile for that level of empathy. The other part of this is you have a much more educated, savvy patient that is going to Dr. Google on the internet way before they're even seeing a physician, you know, face to face. And that brings a whole nother level into it. And is it good or bad? Well, again, speaking as a patient for patients, I think it's great to go out to the internet and try to educate yourself on your condition. And we know, I mean, I saw upwards of 50 to 65% of Americans are doing that. They're diagnosing themselves via Dr. Google before seeing a physician. I think that that's great to come in empowered and educated. But at the end of the day, your clinical team is the boss. They are the ultimate decision maker. They are driving the boat in your care. And there has to be, you know, and this is a big shift because it was an adversarial relationship way back in the day before the internet. It was, I'm going to tell you what to do. I'm going to tell you what pills to take and you're going to do it. And now it's more of a collaborative relationship. It's I read this. What do you think, doctor? And the doctor says, I don't know. I'll take that into account, but let's work together, you know, on a plan that's going to work for you. It's definitely a whole shift. And it's obviously a shift in patient decision-making too, and patient involvement. Yeah.
You're leading me right into the next question, which is, with your experience and having seen some changes in the last few years, considering 3 to 5 years from now, can you imagine what patient involvement could look like?
Well, let's see.
It's a tough question.
I know.
There's so many players, you know, in the whole healthcare, and
yeah.
It's going to take a village to make everything work better, of course.
Yeah. So I guess, I mean, I'll start with sort of like my personal goals, and obviously, you know, I have a consulting business. So, I mean, my personal goals, you know, in 3 years would be like Stacy Hurt would be a household name, you know, and it would be like, a tech company, a hospital is designing an infusion center. Let's go back to my example. They're designing a new infusion center, a new patient center, and they say, you know who we need to call? Stacy Hurt. That girl knows her stuff. She's been through everything, and she's going to give us, the straight story on how we should do this. That would be amazing. I put out a tweet a little while ago. I do watch CNN for what it's worth, and I watch Dr. Sanjay Gupta, and he's the chief medical correspondent. And then one of my digital changemaker colleagues, Geeta Nayar, she's been a guest on there as well. And I tweeted out, one day soon, you're going to see a patient correspondent, and they're going to present a medical situation or a new digital health technology. And they're going to say, what do patients think about this? Yes, would I like to do that? Yes, I would love to do that. But somebody needs to do it. That would be amazing. But so there's my personal goals. But again, getting back to a macro level, this patient consultant, this patient executive, patient voice needs to be a C-suite position, chief patient officer. And certainly if you're out there listening and you are a patient experience officer, you're a CXO, please consider having patients as part of your executive team. There are a ton of us, there are a ton of Stacys that are out there that have had experience working and living in healthcare. And nobody knows this space better than us. And we are ready to help. And there's certainly good companies out there. Another change maker, Jen Horenjeff, who runs Savvy Co-op, she's doing a great job with patient involvement. We Go Health, Snow Companies, Lifebulb, Clara Health, all these orgs I'm involved. They're doing a great job of amplifying the patient voice. So in 3 to 5 years, I foresee, patients, like I said, as part of the leadership team, as part of the C-suite, side by side with healthcare executives, physicians, clinicians, making these decisions that are best for patient care. And that goes for tech companies too, all my tech friends out there that are listening. If you're designing, new apps, new wearables, new telehealth devices, you're going to call up a patient and say, how should we do this? We need your help. We want you to look at this. We want you to hold it. We want you to test it and tell us what we need to do better. So there you go, John. That's the big vision. That's the big vision. So right. I see I'm getting all right. I'm getting very excited.
Yeah, right. Now this is exciting as well. And it ties into kind of a tied-in questions, and you've kind of answered them in advance. But, if any more, like I know there's more digital health apps, and so you do feel like many of them are going to start encouraging patients to share their opinions, and you also feel that this will be embraced by healthcare institutions, and have you thought about the implications, for the future? And certainly there is a lot of good people out there in the medical field and nursing and doctors and good people with good intention everywhere, but it's not been easy to implement it in an organized way. So any last thoughts on this before we move into the Q&A sessions?
Yeah, no, I mean, we're still so siloed, and I don't know why that is. I don't know why we're so territorial. I don't understand these turf wars and this, first of all, in terms of this owning the data, I mean, we need to move to democratize data. Patients own our data. And, no, you don't own my data. I do. And so, for you to hold it up and lock it up and protect it, I mean, that's ridiculous. This is about shared decision making. The more heads that we have looking at this, the better. That's why I always say about second opinions. I don't think anybody should get offended when a patient says, I want a second opinion. The more eyes that we have looking at this, the better. The more input, the better. And then we're going to put our heads together and make a decision that's best for the patient. Patient centricity, it's real. It's having the patient in the center of what's going on. It's having the patient at the forefront. It used to be follow the money. We got to throw that out. The patient's got to be driving the bus. It's the company that puts the patient first will have the profits follow. That's our new model. That's the way we need to think. We need to think about consumer-driven healthcare, and we need to move away from revenue-based healthcare to value-based healthcare, to perceived value for a patient, you know, for us to make a change. These are big shifts, and how are they going to be received by healthcare institutions? Get out your popcorn and just wait and see, because it is going to be interesting. It's a dramatic shift, but it was promulgated by COVID. I don't see it going away. I only see it going up from here. I'm excited to be alive. I'm grateful to be alive, to be a part of it. And I can't wait. I'm excited. We're going.
Okay. Well, this is very interesting because knowledge is power, of course. Which is why there is a lot of organization, not just hospital healthcare organization, but the one in the background gathering the data. And there is some movement also to share anonymized data, which can be helpful for research and for finding what medication works best for what kind of people. But again, I see more and more the movement into have access to that information with authorization from the patient, number one. Another comment is our last webinar was actually about PHR, patient health records. It's a big movement. And in fact, in that webinar, you know, we discussed that certainly there is no competition, because patient carrying with them their own personal health records can actually help hospitals because they don't all yet share the same information. So as you see different specialists, or when you travel, you can actually give more information to these organizations about your own health records, which will help both the healthcare staff and the physician give better care. So we see a lot of movement in there.
Yeah, no, Vincent's doing amazing. And I was gonna say, real plug for Vincent. Vincent's doing amazing work with Animan 7, and his idea of this, you know, patient health record that's portable, that follows you, you know, as you, because I mean, look at people. I mean, you used to stay in a job for 20, 30 years, and that's not happening anymore. I mean, if you're in a job 5 years, you're a veteran. So all of that information has to go with you. And that's a whole separate conversation about, you know, insurance companies. And it used to be that in insurance companies, you know, a problem today is not a problem tomorrow, you know, because you're out there. So how do we, again, increase this continuum of care and have this sort of set of data follow you across specialties that you're seeing, across jobs that you're doing, across geographic areas that you're living in, that can feed into one outcome. I had to give a plug for Vincent real quick, but no, it has to happen. It has to change. It's a whole shift for sure.
Okay. Well, thank you very much, Stacy, for sharing your thoughts and ideas and answering the question we put together for you. Now, a lot of questions are coming up on the Q&A. I'm not sure if you can see them as well. I could pick some for you, or if you want, both either in the chat or the Q&A. There is a lot of really interesting questions.
Wow, this is great.
and I can pick them for you, but I think it would be more interesting if you can pick the question that really you feel you know, very relevant for you.
Oh, wow. Wow, so many of my friends. Why don't you pick?
Sure.
Oh, here's one. This is from David K. Can you briefly point out the challenges you faced while working as a patient advocate? That is a great question. So David, I have never taken a dime from a patient. I considered having a business model where I was sort of like a coach or a counselor, you know, because everybody, when I don't even like saying this, when I beat stage 4 cancer, which I hate saying, because stage 4 cancer is like a cloud that follows you, and you're never quite free of it. But everybody wanted my playbook, and everybody wanted to know, how did you beat cancer? So I created a website, and I put my program on there of everything that I committed to. But ultimately what that led to was, I had a ton of patients reaching out to me saying, will you get me through my cancer? Will you get me through this? And it was even beyond cancer. So the biggest challenge that I faced was trying to help everybody, but I didn't want to take money from them. And I had people offering to pay me. I just couldn't do it. I couldn't do it. And so that was the biggest thing for me, was trying to help everybody and find the bandwidth. I mean, my son needs 24/7 care, and I can't do it all. I can't help everybody. And the biggest thing is losing people. And I get emotional, but losing people, it's rough. Yeah. It never gets easier, but anyhow. I'm sorry, John, did you see one?
Yeah, I'm going to look, but I also wanted to let everyone know, before we end the webinar, we would like you to share with us the website you've created. Oh. I think it would be helpful, and some people may find it helpful or may want to communicate directly with you. And so we really appreciate everything you're doing, and want to encourage communications and positive going forward decision making. So this is great. Yeah, well, maybe several people told me it would be great for organization to have a patient officer within their company, whether it's a technology company or hospitals or whatever organization. Any thoughts on that?
It absolutely needs to happen. I don't know why it's not happening now. I'm dumbfounded. Like I said, I'm completely I'm completely dumbfounded by a patient experience department that doesn't have patients. And if you follow me on Twitter, you'll see that every time I see a panel about patient experience that doesn't have a patient, I call them out. And you guys who follow me, you see I do it all the time. And I'm not going to stop. It's ridiculous. How can you talk about patient experience without having a patient? I mean, it's like an oxymoron to me. It's like jumbo shrimp. I don't understand it at all. And so, no, every time you're talking about patients, anything with the word patient in it needs to include patients giving opinions, and how you're not doing that. It's mind blowing to me. So yes, I see it. Ann Can loves it. My man, Rick Davis, a chief patient officer, you better believe it. And there's so many, I mean, there's people doing great work in this area. I mean, this is Stacy Hurt saying this, but you see, I mean, e-patient Dave doing amazing stuff. Gil Bash, my man, doing amazing stuff. I mean, there are true champions out there. John Novak, true champion. So why this isn't happening, it's beyond me. What else are we seeing here? Oh, here's a nice one.
Yeah, go ahead.
From Lynn, how can digital technology help patients become better narrators and reporters? Wow, I love that so much. It gets back to the lack of education and these gaps that we have in use of these different apps and everything. Technology is so overwhelming. And again, I mean, here's me saying this, who has 2 master's degrees and who, I just turned 50, relatively young, and I struggle, I mean, my 17-year-old son had to just force me to upgrade my 10-year-old laptop. I mean, I'm a dinosaur again, don't tell him, but it's a real struggle to change. And so, digital technology can help patients become better narrators and reporters by keeping it simple. Keeping it simple. John, you asked me for, apps. Here's what I need. Anybody wants to do this. I need, as a cancer patient, I needed a simple app that I could open when I was super sick and could barely even see. Open, Stacy, how are you feeling today? Good, better, bad, awful, etc. And I will press that button and that will go right to my clinical department. And this is probably happening, but I feel like if there was one app, and I just talked to Anne-Marie from Lifebulb about this, I feel like if there was one app for patients that we all got behind, we would all know about it, because patients, we're a cliquey group, and we all kind of look out for each other. We all have each other's backs, and we all talk about what's cool and everything. And I feel like if there was one app for us that really reported what we need, we would all know about it. So I don't think it exists yet. I think it's still out there, but.
Right. Well, yeah. If I may pipe in on this one,
sure.
It's really challenging because we are a country of innovation, and people are innovating all over the place. So I actually see little taste and companies or organizations, whether nonprofit or for profit, creating kind of a beginning of a communication for patients or better tools. But of course, all of them are privately funded or they're self-funded, and it's not easy unless it becomes very large and recognized. I know Ethan Payne had an interesting question related to that. He said, can independent care providers and hospice settings also encourage patients to communicate their opinions freely through apps? And would these be a pro or con for care providers? And again, there is the idea, is it going to be a nonprofit, for profit? Who's going to make it? How do we find them? There is a lot of apps out there. Trying to get attention. And so here's some thoughts for our attendees and for you.
Yeah, we didn't even talk about clinical trials.
Right.
Because I'm a big person on empathy, I believe in speaking to what you've experienced. Obviously, you're seeing that's how I am. If I haven't done it myself, I don't feel like I have sort of the authority to speak on it. Fortunately, I did not need a clinical trial, and I responded to, standard of care first-line treatment. I was very lucky. But finding clinical trials, demystifying clinical trials, enrolling in them, somebody needs to, and I'm talking to good people that are working on this in this area, but that's a whole nother ball of wax that needs broken down and simplified for the patient. I mean, my now deceased friend, Sarah DeBoard, again, one of the sharpest, most intelligent, most fierce colorectal cancer warriors there was. And she couldn't figure out the clinical trial process. I mean, clinicaltrials.gov is just a behemoth, and it's unnavigable. And somebody needs to just tackle that and break it down simply for patients to enroll, find a clinical trial and enroll in it. And that all needs to be on an app, a really easy to use app that you can just go into, and it filters it and everything. And like I said, I know there's people doing good work in that area, and I applaud it, but we're still a far ways away from that. There's so many good app ideas that could be developed, but again, anybody that wants to develop an app, you need a patient focus group first, and you need to come to us and say, what problem are we trying to solve? Right. What do you guys need? What do you need? What's going to help you the best? Tell us just about your day. When you wait, just tell us about your daily struggles and what you go through, and that will develop an app. I guarantee it. I guarantee just talking to patients and what they go through in a day will develop an app for several companies. No doubt.
I'm reading several interesting comments. Let me make a quick summary, and then you can pick what you want to talk about. One of them is for Dr. Kat Zarikta, and she says, Stacy, what could help to make your voice heard about patient advocacy and patient presence at the table? I know part of the answer will be when you share your website in a few minutes. A few other interesting thoughts, of course, is doctors are often taught to use their scientific mind and are supposed to disassociate themselves from feeling, so they can focus on the scientific response to the patient. But of course, we're finding that empathy really get patients to be more motivated, and to really understand and buy into especially for long care treatments or chronic disease, there is more collaboration, from the patient when they really truly understand and start to get educated. Another interesting thought is, and that's a challenge in the US, of course, it's very complicated in the fact that the healthcare is not centralized. It's very much of almost a cottage industry, regionalized, different states, even different regions. It's difficult. We're a big country. We have a federal government, we have states, we have counties, we have cities. It's not easy to fix. And I know a lot of good minds are working to figure it out, not just on policies, but also on kind of it's combination of coming from the top and coming from also the bottom. And hopefully we can find a place to meet where we create a win-win solution for everyone.
Yeah.
Any thoughts, anything you want to add?
So a couple things. First of all, like I said, I sit on this Telemed Now Thought Advisory Council, and we have Twitter chats the first and the third weeks of the month, and we're inviting everybody. Telemed Now, #Telemed Now. We'd love to have your input. But the biggest problems that we look at with telehealth is licensing and reimbursement. So I have very strong opinions on licensing, and I feel like there should be, one universal license. Obviously, for these patients I talked about who need second opinions and crossing state lines and practicing medicine across state lines and those different variances. So that's kind of holding things up. And then of course reimbursement. And I believe strongly that physicians should be reimbursed on par with what they're doing, via telehealth as they are in person. I mean, just because I am unable to get to the doctor, either because I'm too sick in bed with chemo or I can't, lift Emmett, into his wheelchair, why should I shouldn't be penalized for that. Why should my physician be penalized for that? Because I'm doing a telehealth visit. So, I fight for my physician friends, that their lives should be made easier. So that's what I wanted to say about, sort of some of these silo issues that we see. The other thing that I want to say about the empathy, and I should have shared this when you asked about my inspiration, when Emmett was diagnosed via genetics, I'll never forget, and this will be in my book that I'm supposed to be starting. The geneticist said to me, "Your son will never walk or talk. Get used to it." That's what she said to me. I will never forget it. And it defined my entire journey with Emmett. And I'm trying not to get emotional, but I was determined to prove her wrong. And it might have been maybe a cultural or a language barrier that played into what she said, but I'll never forget what she said. And I was determined to give Emmett a better life than anybody could ever have predicted for him. But that taught me everything that I needed to know about having empathy and knowing what it's like for you to hear, like, imagine your own child not being able to walk or talk. I mean, that's what I deal with daily. And I feel like that physician should have taken that into account when she delivered that news to me. So I do speak to first day med students. I'm proud to say I do that at the University of Pittsburgh. And I talk to them a great deal about having empathy for their patients and imagining what they're going through on a daily basis and hearing that news, hearing those 3 scariest words in the English language: "You have cancer." I'll never forget when I heard them and how I felt. And we really need to go the extra mile and think what that's like. So,
well, yeah. Stacy, thank you for sharing from your mind and from your heart as well. Really appreciate your thoughts.
Sure.
Before we leave, and I think a lot of people are interested in communicating with you, I'd like to make you the presenter, and maybe you can share your website. And in case we don't get to it, I want to thank you everyone for being here. I want to thank you for your thoughtful interaction with everyone. And so really appreciate everyone joining us, and we wish you the best of success through 2021. In case some of you have more questions about OSP Labs, feel free to visit our website, osplabs.com. We publish, different webinars and case studies, and happy to answer your questions if you want to attend the next one. For now, let me quickly give you the, make you the presenter so that you can share let's see, your website. We would love to see that. Okay, how do I do that? One moment.
Sure. And while you're figuring that out, I really want to thank everybody for joining. And there's so much in the chat right now. I'm a little overwhelmed, and I'm a very slow reader. I don't read books for that very reason. So please, we're going to roll up this chat, and I want to address anything and everything that's on everybody's mind. So please, if I didn't address your question, I will. And I'm going to show you my website right now. This is my website. I'm at stacyhurt.net. Don't go to stacyhurt.com because you will get an artist in California, and she does lovely work, but it's not me. I'm stacyhurt.net, and there is a section over here that you can contact me. Please, like I said, if I did not get to your information in the chat, please reach out to me. But my story's on here. What I did to beat cancer is on here. Also, the work that I do is, this is me. I'm forging a new category. I mean, this is what we're doing. It's patient engagement and patient involvement and ensuring that the patient voice is represented. I'm happy to help you in any development work that you're doing. You want me to take a look at things. I'm very affordable. And also for speaking, I'm much more affordable than Brene Brown or Simon Sinek. And I'm going to give you as equally as emotional and passionate of a message. I can guarantee it. So please, if I can help you, I'm happy to do that. But these are the services that I provide. Like I said, back to this. If you want just an informational talk, I do that. I speak to sales forces. I speak to development teams. I have client references on here, or like I said, if you want me to take a look at something that you're working on and give you an eye, I have seen it all, I have done it all, I have been it all, except been arrested. I can tell you, I have seen it all, and I'd be glad to help. Yeah, so everybody, again, I really want to thank you for taking time out of your day. It's a holiday week for so many people, and to give up your time to listen to me. I hope I gave you some value. And it has been a really difficult year. Hang in there. The next normal is coming. Stay safe, get vaccinated, and keep doing what you're doing. Patients like me appreciate you. Caregivers like me appreciate you. Thank you. Thank you, OSP Lab.
Thank you, Stacy. And by the way, we are going to share the recorded link to this webinar for if you couldn't be here. And thank you very much. Have a wonderful upcoming weekend, everyone. And be happy, be safe. Thank you. Would you mind? You can stop the meeting, Stacy. Thank you.
Okay. Thank you.
Thanks.